Welcome to the Onondaga County Health Department Narcan Training. In this training, you will learn to identify the signs of an opioid overdose and how to reverse it with naloxone, also known by the brand name Narcan. Opioids are a broad group of pain-relieving drugs that work by interacting with pain receptors in your cells. On your screen is a list of commonly used opioids. What are risk factors for overdose? Low tolerance. We often see this after a person finishes rehab, is released from jail, or has any other period of time where they are abstinent from opioids. Mixing of drugs. This can be intentional or unintentional. Unknown product. Due to variations in potency or taking a substance unknown to the user. Serious illness. If a person is immunocompromised, they will be at a higher risk for overdose. Using drugs alone. If a person is experiencing an overdose, they cannot call 911 or administer Narcan to themselves. Naloxone will temporarily reverse any opioid overdose, including fentanyl. Naloxone lasts 30 to 90 minutes. This is very important to remember because a person could potentially slip back into an overdose after the 90 minutes. Naloxone comes in multiple forms. You will most likely be receiving the intranasal form as pictured on the screen. Naloxone has an expiration date and should be stored at room temperature. Naloxone is safe to use on anyone, including children and pregnant people. It is harmless if given to someone who is not experiencing an overdose, and it only works on opioids in the body. Signs of an overdose: unresponsiveness, slow, shallow, or no breathing, change in skin tone color. A person with lighter skin may become bluish purple. A person with darker skin may become grayish pale. Lips and fingernail beds may have a bluish tint. Unusual gurgling or snoring sounds, and pinpoint pupils. If any of these signs are present, perform a sternal rub. This will be demonstrated later in the training.
After you complete your training, you will receive an overdose rescue kit. In this kit, you'll receive 2 doses of naloxone, a pair of rubber gloves, a face shield for rescue breathing, a blue certificate of completion, and a responder form that we would love if you return to us with information on any reversal that you perform.
Action steps. Always call 911. Give Narcan. Begin your rescue breathing. If no response in 2 minutes, give your second dose of Narcan. Continue with rescue breathing. When the person wakes, keep them calm. Explain Narcan is temporary and the risk of overdose remains. Inform emergency medical services what happened and how much Narcan was given. Report reversal to Onondaga County Health Department and get a replacement kit.
To check for unresponsiveness, you can do the sternal rub, which is where you take the pointy part of your knuckle and grind that into someone's sternum. You do that with a fair amount of pressure, and it's pretty uncomfortable, so if someone was able to respond to anything in their environment, that would do it. After you've determined that someone's unresponsive, they may or may not have other signs of overdose, you can administer your naloxone. You'll take that out of your kit, and you'll insert the tip of that into someone's nostril and press up on the plunger. After you've administered your first dose of naloxone, if the person has not woken up and is having trouble breathing or is not breathing at all, you can perform rescue breathing on them. In your kit, you get a face shield. It comes in a package like this, and when you take it out of the package, it looks like this. There's a filter right in the center. Put that on someone's face. You would pinch their nose closed and tilt their head slightly back, and then do 2 quick breaths and a breath about every 5 seconds for approximately 2 minutes.
911 Good Samaritan Law. This law empowers you to save a person's life. The law encourages anyone to call 911 when they see or experience a drug or alcohol overdose. Who is protected by the 911 Good Samaritan Law? Everyone, regardless of age, who seeks medical help during an overdose. The person who has overdosed is also protected.